Hello everyone, I'm Ritanya and my team is a member of five. My teammates are Dayashita, Harshita, Kapin, and Kishore. The domain that we've chosen is healthcare. Let's look at the domain introduction. Healthcare directly affects human lives and well being. Technology and data is applied to solve real world healthcare challenges. Students gain hands on exposure to hospital operations. Let's look at the industries that we've got engaged with during the period of social internship. The first industry was KG Hospital in Coimbatore. We got to learn about multi speciality operations and advanced treatments. The next industry was CRI Trust Healthcare in Saravanampatti. We learned about affordable CSR driven healthcare delivery. The last industry that we got engaged with was Allreal Company, located in Ganapati. This is an AI integrated technical company. Persona details and pain points. Persona. Regular patients seeking timely hospital beds. Pain points are bed unavailability, admission delays, and family stress. What are the gains that we get when we find solutions to these pain points? Quick bed access, clear availability of beds, and reduced risk and stress.
Hello everyone, I am Dayushita from CSE department. I will be explaining our problem statement. We are addressing a critical and common issue in hospital management, the unavailability of beds during emergencies. Currently, most hospitals rely on manual methods for tracking bed availability. This leads to major delays when patients need to be admitted quickly, especially during emergencies or peak times. This delay can lead to worsening patient health, increased stress for medical staff, patients, and their families, and in some cases, it can even be life threatening. Additionally, patients often have no way to check real time bed availability before arriving at a hospital. Our goal is to solve this problem by creating a more efficient, automated system for managing hospital bed availability.
Hello, I am Harshita Devi from Computer Science Department. We need to discuss about technology map to the challenge because this is the brainstorm solution concept, a data-driven bed management system using software integration, centralized digital dashboard, a signal software platform showing real-time bed status across all hospital departments, integrates directly with the hospital's existing patient administration system (PS), predictive analytic algorithm, software that analyzes historical admission rates and trends, forecast future bed demand to help staff anticipate and prepare for surgeons, automated notification system, triggers instant SMS, emails, alert to bed managers and cleaning staff upon a patient discharge, streamlines communication and significantly reduce bed turnover time. Feasibility. High feasibility and it is a software-based solution avoiding costly hardware IoT sensors, leverages existing hospital data and IT infrastructure, sustainable due to low maintenance and operational cost after implementations. Thank you.
Now, I am going to explain you about the what are all the societal and technical impacts present in the real-time hospital bed management system. Societal impact. It enhances the patient satisfaction with smoother hospital experience, which means that patients can easily track their bed availability status and book their bed using the bed booking system. Reduces medical errors by ensuring better bed allocations because emergency cases will also may be come in the hospital systems, so we can avoid easily avoid the medical errors by pre-booking the bed by the bed booking system. Next one is support equitable care by prioritizing patients based on need. Medical system involves normal patients and also being emergency patients. The patients in emergency condition needs the bed for their medical purposes very easily and effectively. So we need to allocate them and prioritize them. So this point says that. Next one is minimize staff burnout by streamlining workforce. In traditional systems, we always use the staffs will allocate the beds, and it takes a time consuming process. But in bed booking system, we can easily track the bed availability status and book the beds as we want. Next one is what are the technical impacts present in this? Enables real-time monitoring for operational decisions, which means that we can always see and keep the track of the bed booking systems or all the availability of beds. It's this point says that only. Next one is facilitates predictive resource planning, staff, equipment, and beds. Supports integration with future digital tools, health tools, and telemedicine apps. Generates historical data for policy making and research, which means that we can analyze the previous and past data records to see when the bed allocation is fully filled and what are all the dates it not been filled. Next one is improves system reliability and reduces manual errors in hospital management, which means that we can easily rely on the system, bed booking system, and it reduces the manual errors. Means that the staff will not be allocating the bed status. Instead, we can easily book the beds. This point says that only. These are all the technical social impacts which are present in the real-time hospital bed.
I'm going to explain about the summary and key takeaways. We have learned some learning outcomes which are integrating smart software, which will reduce the amount of cost rather than using hardwares where it is very expensive. By utilizing the smart software for small bed allocation system, the users can adopt it very efficiently and understand the workflow of it, and it impacts the real world human of highlights and inefficiencies, and we can understand the importance of cost feasibility and sustainability in software integration rather than hardware, where users can feel very comfortable using the smart software, and then they can find their allocated beds. Thank you.